Okay, one of these things is not like the others, and I'm not quite the same because I am not personally associated with CubeMonk unless I'm like an honorary board member today. Now, who the hell is that guy?
That's
Is he
another
one of you guys
CubeMonk.
too?
Gentlemen,
That's
what's
probably
going on?
Nick. That's
Hey,
Nick.
Are you also
Uncommon pleasure.
CubeMonkey?
I am part of
Now,
the Cube Monkey group.
the whole world revolving thing is so not working because we can
You
see.
don't like that?
Oh man.
No, it's not even a matter of that. The space between your head and your earphones are letting us know you're in like some kid's basement. So take off the world thing. The whole illusion has been shattered.
Ah, man, I thought that you guys were fooled too.
No, we're not.
Bummer.
Earth to Nicholas.
You know, that's funny because I actually trying to figure out how to turn that off.
Okay, you're wasting everybody's time. Daniel Cunningham, isn't this your brainchild, this whole CubeMonk thing?
Yeah, I mean, our group, our collective, our team. I approached obviously the team that's on the phone today, and we come up with some interesting ideas around technology, automation, machine learning, and containerization going forward, utilizing IoT devices. Just looking future forward and at the industry as a whole from a moving and storage perspective, which is what I grew up in. And along the way, Joe, as you know, I stayed in touch with you, brother, and just understanding where this could go and grow into as technology evolved and what we were doing evolved. I knew that medical devices, pharmaceutical, and other verticals would come into play, and we're at that point now where we've done the last miles network within the moving and storage space. We've been able to prove out everything flows and automates with the containers and the technology. And, we just wanted to kind of, get out there and start talking with the medical devices vertical and group. And we knew that you were, the person to connect there. That's right, brother. And, just looking to, kind of spark some interest and spark some conversation around what's it look like today. We're the new guys when it comes to medical device shipping. However, I think based on looking at the industry, looking at our container, all the technology that's tied to what we have, I think what we've developed works for this industry very well, considering it's not something where you have to buy crates, ship very expensive crates once, and then, get to destination, take out your items, and then throw the crate away. It's something these can be reused. And I thought that would be an interesting thing for the group here.
Okay, so I'm going to ask you linear questions at some point so we can get from why the hell are we talking to some shipping guy in the medical devices group. But first, two things. One, you may not know, I sold my home, we're moving, and I was just rearranging some shelves, and I discovered that, I don't know how old these are, but I found like these chocolate covered raisins, which is like my favorite candy. So I am going to eat some of those because I didn't get up in time for breakfast, and I wanted you to know what that noise was. Second,
Understood.
is the vaccine apparently needs to be shipped at negative 70 degrees Celsius or Fahrenheit. I don't know, but really effing cold. And since we're talking about shipment, I know this is not the logical place to start to learn about CubeMonk and what you're doing, but thoughts on this? Can you help? What can I understand about, if I were an opportunist and I got in fast enough, which companies could I even invest in that are going to have unprecedented demand for incredibly cold shipping containers?
It's going to actually, interestingly enough, it's going to have to go into the food transportation side in order to get freezer trucks that are capable of shipping at that temperature. We are working on temperature controlled units, but nothing to that degree where it's negative 70 or whatever the case, whatever numbers you said. But I can tell you, we could do something, but we'll never get something quick enough as fast as they're going to need it. For what we're doing, we're just breaking into this space. We're just trying to come in, get some conversation started. Jonathan's put together, somewhat of a flow for this, and we kind of let Jonathan talk through. And, if we could, I'd like him to kind of run the call, and I'll be here for backup support. Not so much the face of the company. I work in the background, as you know, on product and the technology side.
Okay. And perhaps, and I'm sure Jan is going to be an active participant in the call. In fact, I'm going to bring her on, and John Tugwell has something to say, but Jan, is my go-to for packaging. She's somebody you should know anyhow. So I'm bringing them both on.
Perfect.
Jan still is out of this world. Yeah, there she is. You made 2 comments already, Jane. You want to put on your mic, or do I need to do that for you?
He said last mile, and there is a big group actually working on last mile, but then he talked more and I realized he's talking the intermediate area, not actually the last mile that the group is working on. And cold chain, there are a whole bunch of conferences on that. So hopefully you're going to those and seeing what they're talking about, because the best known one, I can't even remember the name, is in Philadelphia once a year.
Yeah, actually, I know that conference. They've sponsored me in the past to promote their event. Oh, that's lovely. Now you're in the grass somewhere. That's nice.
Yes.
Um,
I don't like the way my desk looks, so behind me.
It looks better than where Nicholas is sitting, so don't worry about it. Interestingly, Ken has a backdrop of a kitchen. I've never seen that as a selected backdrop. John Tugwell, what do you have to say about all of this?
Still thinking. It's still early for me.
You raised your hand. Did you have something to say, or you just?
You were talking about the number of Johns, and I'm usually, most companies I work with or consult with, I eventually default to JT. So if you want to change that to JT.
John, do you have anything valuable to add here or not?
No, that was a long time ago. That hand raised.
I really like to hear more about the company and what they're doing, because I do a lot of work with medical devices and some pharmaceuticals, and cold chain is always difficult, and not necessarily just the frozen stuff. Actually keeping it at a what they call normal room temperature has been more of an issue, because people try and ship it without any temperature controls and then wonder why their product is getting spoiled.
And Dan, you started by talking about freezers for food storage, but that's not going to help me once we get to the clinic or the hospital, unless you're just going to park it outside. I don't really understand how all of this is going to work.
No, when it comes to freezer units, we're not there, Joe. We are working on they call it a temperature controlled unit, which is more for the produce and pharmaceutical type shipments. But medical devices, we haven't come into the need for basically freezer transport. So we haven't even gotten there. We've started in the moving and storage space intentionally, so we could build out the mover network, the storage capacity, as well as last mile services where they could receive it, deliver it out, set it up for the client, and then obviously take the container back to the warehouse for redistribution. So that's our
We'll
core.
start at the top. So Jonathan is our guy?
Yes.
I'm your guy.
All right. I'm going to temporarily dispel other people, even Jonathan wannabes, so that we can have him be front and center and tell us a linear story that helps us understand why did Joe Hage invite you to talk to the group today?
And am I able to share my screen?
You certainly are.
Okay. I'll shift over to that. Well, thanks for inviting me and my entourage of other Jonathan Estes clones to this call.
There are a lot of wannabes
They're actually, yeah, they're my, actually, they are who I aspire to. They are all different experts and have been working in this field, in some cases, much, much longer than I have. My background is in ed tech, and I've been working with the technology companies for actually over 30 years. And this discussion about, educational technology. It just so happens that when you were speaking about last mile on the cold chain, one of the projects I worked on in sub-Saharan Africa was distribution of pharmaceuticals of HIV/AIDS drugs to last mile providers. And the partner in that cold chain was actually Coca-Cola. It was the only company that actually brought a refrigerated truck out to the last village in Africa. So Coca-Cola goes everywhere, and they were the best partner. But what I'm going to present to you is basically a description of CubeMonk, whom I've been working with the last couple of years. I've known Dan working in this industry, and this technology has been around for more than 10 years. This is an evolution of a progression that includes not only the logistical technology, the software, but also the hardware of the actual containers. And the evolution of these containers are what really is at stake here in terms of how do you meld being able to know where something's at any one moment on a GPS, but also what's the condition of the contents of that of that shipment, and where is it, and how, and every stage of its development from one end to the other. What do we know about it? And surprisingly, when I joined Dan and working in this field, and why I was so excited about it, was how it was one of the few industries that really has not progressed in terms of bringing this automation into focus. That the shipping industry in general, regardless of what vertical is involved, is still down to Excel spreadsheets or pieces of paper, bills of lading, pencil and paper, basically, to get something shipped from one end to the other. And also the amount of damage that's done in shipping is enormous. What I read was sometimes it's 30 to 40%, and the cost of insurance and claims and everything is just exorbitant. I can
won't
only
bring her back
imagine.
on right now, but Jan, if you would leave a comment, if you happen to know from your vantage point what percent of shipments are damaged, that would be interesting to me. Jonathan, I believe the presentation that you will share could theoretically be given to any industry.
It
Is that
could,
true,
yes.
or is this very
It is
medical
true.
device specific? And if not, what is it about medical?
This presentation is.
If in fact you could apply what you're about to share with us to any industry, and there are hundreds, if not thousands of them, why are you focusing on this vertical? What do you see as the major opportunity that devices is what you're going to focus on?
I would say that first of all, this can be applied to any industry. We have identified, and working with Dan over this last couple of years, the number of industries that are in this need in terms of shipment and automation and security and awareness of the current state of every product that's being shipped and where it's at, and lowering the cost and the sustainability is absolutely needed in every vertical, every industry. The reason why medical devices stands out has a lot to do with the sensitivity of the contents. There's a unique ability for what CubeMonk has developed to provide a customizable container that's reusable in an industry that may need to have a kind of closed loop network of shipments that are sent and possibly picked up and used again, and where where crating is not something you continue to waste, that you actually, and the cost involved with having to recreate and repackage things, that if you had something that could be reused over and over again is one thing. The other is the container quality is, in the case of CubeMonk, the ability for these cubes to sustain a lot of damage or a lot, I should say, abuse out in the shipping world that protects whatever the contents are. So anything that's sensitive, that needs security, that needs awareness of access, like a GPS, and whether it's been opened or not, whether it's been tampered with or not, all of those things fall directly in line with the value proposition of what CubeMonk provides.
I'm going to silence myself and make myself disappear and do your thing. Let's see some slides.
Great. So just continuing that whole discussion, and I will preface this by saying that, as Dan mentioned, we are new to
we have some technical difficulties, I think. Dan said we are new to, and then nothing. So I'm going to bring Dan on to fill in while Jonathan's connection gets reestablished. Daniel?
Hey guys. Somehow we lost them.
Yeah. Good thing we have a couple of Jonathan Estes in spare.
Yeah. He's the one that put the deck together, though. Unfortunately, I've been in raise heaven. We've been working on a massive raise for our business to scale up in other countries. And
how much are you looking to raise, and how much have you raised so far?
We've brought in a little over 6 million, and right now we're doing a $50 million raise. Yeah. Yeah, and to Jonathan's point, with regards to why medical devices, and it's so much, there's key there is, shock sensors. I mean, we do know that claims are in the 30 to 40% range, and some of this equipment that is being shipped in the medical device side is, it's really expensive, and we aim to, give people the ability to do, basically shipping at a lower cost but more secure. There's a Go ahead, Jonathan. Jonathan's back.
Okay. Sorry about that.
Yep.
Somehow my internet just recycled without asking. I was that thing
We're going to
that
keep a spare Jonathan on just in case, though.
history right now is being absolutely recreated. So, can you hear me okay?
You're a little spotty. I'm going to keep a spare Jonathan or two on hand just in case.
Okay, that's great. Thank you.
Mm-hmm.
So the in terms of a shift or an area of opportunity that we're seeing is that, or a need is in the expediting of medical devices and PPEs in not only in volume, but also ensuring the level of quality, arrival, and minimizing costs and all those things in terms of the speed and how wide distribution is needed for this. Then the other areas that have been listed since, I'd say, over the last 5 years in terms of shifts that are taking place in the industry. One of them, across all of them actually, is the idea of automation. The number of steps involved in expediting a shipment involves steps that the CubeMonk system actually creates one location in which all this can occur. So what normally would take multiple calls, multiple members of the community to pull something together on one shipment is now streamlined into one program. The other is getting real-time visibility. Transparency has been one of the toughest things.
You're really
Yes.
coming in and out quite badly now.
Go
I
ahead.
don't know if you have access to better connectivity, or if maybe
I may have to just take my video off. Let me take my video
go ahead
off.
and take your video off. Let's see if that helps. And
Okay.
let's give that a try. And if we still have difficulty, maybe you send me the slides and I run them, and either Dan or Ken or Nicholas give the presentation. So can we hear you?
No problem.
Okay, good.
Is that a little better?
It is.
Can you hear me all right?
At the moment, yes.
All right. So the other aspect of this was the transparency issue, and what is greatly needed is the ability to know more about what's happening in a shipment. It's one of the most unknown areas of when we have the transport of goods goes invisible basically for such a long period of time. But with the CubeMonk system, it actually keeps things in a constant state of visibility, from knowing where something's at, whether it's been tampered or opened, whether it's what its humidity and temperature are. Things that actually matter to many shipments are now possible to have access to. And the last is actually taking out a lot of the cost by having the middlemen involved with the process. Helps to reduce that cost. So this automation, transparency, and streamlining the process are value propositions that I believe are really needed within the medical device shipping industry.
Okay. I added.
Do you have anything to add, Dan, for that kind of history?
I added Jan because she's left a number of comments, and I went to add Ken back, but it seems as though he's gone. Jan, you want to just interject a few things? I want to give him some flow and let him make his presentation, but you have so many things here now that I thought just mention these because I want this to be helpful for them as well. You might have some insights that could be helpful for Dan and Jonathan's company. Can that be heard?
Kind of shipment is definitely needed in medical devices. He seems to be talking more about equipment where I usually do the smaller devices. But I'm looking at this, and everything you're talking about, I belong to committees where they talk about it and are trying to do things. So I don't know if you are part of those groups like MHI, and because they do a lot of work with this kind of shipping and tracing, and they're trying to get more of the technology out. But that's their whole thing. They do a lot more than just medical devices.
Jan
So
Cunningham, I think, I'm speaking on her behalf, she can correct me. I think Jan has some capacity. She might be your next hire. No, seriously, you guys should talk after this.
yeah, there's a lot of what you're talking about. I know I've seen, but I've also been able to compensate for it. And I have found other technology that does what you're saying, but it's not, they didn't think of it for shipping initially that
Well, I
way.
think
So
that in and of itself, that basically what you just said is, given that this concept didn't exist before, you've for years or decades come up with workarounds, which now is being addressed here. And if the delta is so great that this is so much better than the workaround, these may be value proposition points that CubeMonk can use to accelerate their development and raise, etc.
especially with this last mile, which is a little bit farther than what you're talking about, where it's actually where we get from the loading dock to where it's actually used by the customers. This kind of stuff would be great. And we've got big groups that are meeting and trying to figure out what to do about it. So
Okay.
it's interesting.
Beautiful.
Jonathan, you want to take us to slide 3?
So the CubeMonk technology is made up of several components integrated. It's basically includes a process of creating a self-routing. What really made me excited about this when I first heard about it was the capacity of creating an autonomous system, which may or may not be something that operates initially within the medical device community, but I feel like the concepts of sharing economy and interconnected markets where you have access to different shippers that qualify within this marketplace, this helps to streamline that whole process and create a system where actually the cube actually looks for a place to get shipped. It actually has the ability to be needed and make itself available within the network. So in the case of CubeMonk having not only the cubes online, but instead of having to go hunt down a shipper, this actually brings them as available to you when you have a need to ship something. So Dan might be able to describe that process a little bit more in terms of that value, but this basically is a no cost to the people, the network that's involved, because being part of the network means that now these cubes and their ability to be part of the marketplace is something that is automated and available to you as on an on-demand basis. And it helps we've made the case for this to be a cost savings because, as for some of you may not know, most of the shipments across country go usually 30 to 40% empty, and on average. And the amount of fuel that's wasted as a result of those shipments not being full is something that CubeMonk is also seeking to strive to overcome, which is it saves money to have shipments actually filled, as well as save on fuel, which affects the environment directly. So that whole closed loop model of eliminating the waste of actually having these shipments go empty is what CubeMonk is also trying to solve.
My friend Luke adds, I still have absolutely no clue what Jonathan is talking about. Show us a cube.
That's the next slide.
Yay!
So CubeMonk is actually, in its current form, the cube is actually a composite crate, basically made up of a composite steel. It has standardized sizing. You can get this cube into other containers or across ocean shipments with a standard size. They're stackable. They're movable. As you can see, the slots on the bottom, you can use a forklift on either side. They have retractable wheels. A single person with a full cube could actually move this around with one hand and get it on and off ramps and things like that. And then baked in, it's got the Guru technology, which is a chip that keeps track of, it has the GPS and the intelligent routing, optimized dispatching. So each cube then becomes smart. It basically knows where it's at. It knows it needs to be shipped, and it keeps track of what's inside.
This doesn't
So-
fit in planes, or does it? Because it doesn't look like it has the right sizing for that. Cargo
Jan, it
plane?
does. Jan, it does. What we have an issue with the FAA is the metal frame on the bottom. We have to actually, we are aware of this, and we are working on that. You have to have, it can't be metal, you know, so we are working on polyurethane bottom plate that would allow us to do FAA regulations. But we've done a lot with the device with the FAA regulations to make sure it shuts off going up in altitude and turns back on coming back down. So we are working on this to go where we can do air freight with it as well. But right now we can do rail, we can do ISO containers, and we can do LTL or truckload.
Yeah, it looked good for those.
My ignorance in this category is profound. My knowledge of shipping, it ends with the word pallet. Can I get a sense of how big is this relative to a pallet, a typical pallet size?
Joe, this one here, we call it the 2-skid mover. So it's basically 2 skids, and then you know, the width and the depth is 2 skids, but the height is also 2 skids. So it's basically meant to fit within the transportation space to maximize use. You know, obviously, as Jonathan put out, we're looking to maximize the use of every truck and minimize waste. So we have 4 different iterations of the container, 4 different sizes. So you can basically play Tetris in any mode of transport anywhere in the world.
That's very funny. And I think you've just like introduced it to an entire other generation. They totally want to play Tetris with their shipments.
Yes, and this is EU size then, or is it US sized?
This is US sized. It's 200. This particular one you're looking at, Dan, is 202 cubic feet.
And how many configurations do you have?
Right now we have 4, and we can, you know, if there's custom things that we need to do for this business, this vertical, you know, we're open. We have the ability to do anything, but right now we wanted to keep it fairly standard because our network and last mile providers all over the US, Australia, we're working in China now. You know, this is a size that everybody can handle with their current equipment, which is usually, you know, trucks with lift gates and manpower, and some of it is trailers, and some of it is Moffett trucks, which is flatbeds with a lift on the back.
Soumya, did you have a question or a comment?
Yeah, I mean, great technology. Dan, do you actually sell these cubes or rent them out?
That's a good question. We basically, you know, we own the containers and we just use them for all the shipping, and even the quoting, the booking, the tracking. It's all done virtually. It's all done online. There's a bunch of ways we could do this. We could do this where we give someone access and they can do everything on their own. Or if they just want to hand us the shipments, we can take it through CubeMonk, our operations team, sales team, customer support and service. We can do it that way as well.
Sure.
I'd actually, because this concept is so afield from what we typically discuss, and I have not contributed to the linear presentation here, I suspect that there's a lot of folks on the phone who, like Luke was like, show us a cube, who have lots of like different questions that are like, we don't even know what you're talking about kind of thing. I encourage you more than usual, folks, to type in whatever you're thinking, wondering, because I think it'll be helpful for the CubeMonk team to, in their future presentations that aren't so interrupted by a host like me, to see kind of like the sequence of questions that need to be answered, because this is so afield, I think, from what most medical device manufacturers are even thinking about. It's like when I counsel folks who want marketing strategy, I'm like, you have a great solution for something, but they don't even realize that it's a problem. I mean, they might kind of know it's a problem, but it's not the problem they have to solve today. And we need to put some urgency on it about why. Jonathan asks, who are your key clients now? How old are you? How long have you been around? How much success have you had so far, Jonathan, Daniel?
We've actually been building and planning and testing this thing for the past 7 years. We launched the company as CubeMonk in September 2017 with our first 60 containers. We have been through now into our third iteration since then, just because we've learned about the freight industry and how rough they truly are with the things that they're shipping. Yeah, and we, as we stated earlier, Joe, we've come to that point now where we're ready to scale. So we've gone back out and we're done self-funding. We spent a little over 6 million, of our own to get it where it is and proof of concept to where it is. And now we're going after institutional funds in order to scale this. And we're also now looking to break into other verticals outside of just moving and storage. We've set up a fairly strong network, for last mile services and to be able to receive, deliver out, load and unload product. And now it's time to grow, and we're looking at medical devices for obvious reasons. Used to be you would ship a medical device and sometimes it would take a whole truck, or you'd have to do dedicated loads and a lot of damage. And here we give someone the ability to take something smaller, our container size, and do it through the typical LTL, which is sometimes 30-40% less cost. So there's a lot of savings here in what we're doing. There's a lot of analytics that are being reported on that typically that's not, they're not capable of doing that. Sure, they can give you EDI pinpoints of where things are, but most of the time, that stuff is a couple days old. So we wanted to do something more in real time.
I'm smart enough to know that LTL means less than truckload, and there's a whole industry around that.
Yes.
How, if at all, are you integrating with those systems or letting them know about you? Or
That's a good question, Joe. We have tied into up to 1,400 carriers in real time. We know what their capacity is. We know what their pricing is in real time. The system, it's more like in the background for us. And even if someone logs in, we give all the options similar to like a Expedia or a hotels.com. You can pick and choose your guys that are going to store it, load it, unload it, transport it. It's completely up to you. Or you can set rules based on your particular shipment types, and it'll only give you those types of results. So we made it very, very user-friendly, API in and out, XML. We made this very friendly to connect to because we're very aware there's a lot of legacy systems out there.
Okay. Rick, you want to ask a question? And you're making us dizzy, Rick. Sorry, you are muted.
The tiny screen interface is harder than the big one. Well, first of all, I've worked around a shipping department, but I've never been in one. So there's probably a lot of terminology I don't know. But what I always try to listen for is, if I had a client, how would I tell them this might be really useful and either save you money and headaches or save you money just in raw shipping costs or something like that. And so what I couldn't understand very well was the exact case for what was this better than.
And Rick, for context, tell him briefly, my loquacious friend, what you do for a living.
Okay, I work with design and manufacturability issues with companies. I'm a designer by trade, but I do a lot of other stuff. And so I'm not in the middle of shipping and logistics, but I end up interfacing with it enough to appreciate what we do.
Talking with Jan, I always appreciate when she tells the anecdote of somebody designed something and she'll say something like, did you realize that if you made it an inch shorter, you could have saved $200 million? And,
There you go.
Yeah, this is part of packaging, is how are you going to ship this thing and what sizing and how are you going to get it from one place to another? And most people don't think about that. That's the only thing I'm worried about with this particular system. I can't even get them to think on how many units they want to sell at a time or put in a case. How are they going to think about making sure everything fits in in the unit itself? Though, if they would, this looks so much better than anything else I've seen. It's incredible.
Well, and again, I don't think we're trying to reinvent the wheel. We're trying to take technology where it truly is, and we're trying to apply it to an industry that is antiquated and it's, disparate systems. And, people are using 3, 4, 5 software platforms to do one job. And that's just not needed anymore. With machine learning, truth and transparency is inevitable and optimization is inevitable, down to, fine tuning, consolidation. We have built a tool, we believe, through automation that will bring down the cost of shipping as well as increase efficiencies, and it will also provide us a way to consolidate. So if someone's only shipping 3 or 4 cubes worth of goods and we have 10 other people that are shipping the same and they're booking it at LTL, and we get the capacity or capability through volume to consolidate that into a truckload, we even can provide further savings. So, what we've done is we've just basically taken the industry as it is, and we've applied a lot of technology and automation and analytics and machine learning.
Rick, has your comment been addressed, or no, because we went afield?
Not quite connecting the dots. Again, I get a real impression that y'all totally know what you're talking about. But what I would want to hear is something a little more concise. I know, Joe, coming from me.
That is ironic.
Yeah, it is. It's extremely ironic.
Mm-hmm.
But for instance, if you were to describe me by saying, Rick Stockton is the guy that you hire to bring scalability and manufacturability to your design. One sentence.
I'm impressed, my friend.
Thank you. So tell me if I'm wrong. Tell me if I'm wrong. I'm going to try and summarize what you do. You use analytics to streamline, combine, and in other ways cost reduce shipping. And I'll just stop.
In the end, you're right. That's the end game. But there's a lot of stuff in the middle that we're leaving out. Analytics just aren't something that's available in this space. Once you ship it, you hope to see it on the other end. That's not the case anymore. So we're providing that purview from beginning to end. There's a lot that we're doing here. It's a big project, obviously, and we've been able to prove it out in the moving and storage market, and we're thankful and blessed by this group today to have the opportunity to present what we've done in this space and looking to get into the medical devices space. So that's why we're here today, and we thank you for your comments, Bill. And obviously, if there's things outside of this phone call, that we can have conversations about, and we can define clearer, we can certainly represent in the future again. But that's what this call is for. We really didn't know how to approach this. We're looking to, come into this space as newbies, if you will, when it comes to shipping medical devices. However, we did manufacture these containers with medical devices in mind. Inside we've built 3 different tiers and decking bars, which I'm not sure anybody's familiar with from a transportation perspective, but every 6 inches on those decking bars is tie-offs as well. So we can absolutely maximize security of the load. So it's not tipping, or, if it's a specific type of machine or a laser or whatever the case may be. So we've taken a lot of design into this to make sure that it fits different verticals and as many as possible going forward. And we felt medical devices was a really good one for us because we understand the value of the product. We understand the efficiency and time constraints for the space. And obviously claims are massive in the space. We know that. And we're looking to find ways to interject ourselves where we can be of assistance in this vertical and prove it out even further for ourselves.
And Jonathan, in the background, if the questions lend themselves to different slides, even if you don't have a chance to talk to them, you're welcome to do that.
Absolutely.
Robert Packard, you have a comment?
Yeah, I was wondering, I had missed part of it because I had a call I had to take, but you talked about consolidating loads going to contract packagers or contract sterilizers?
That didn't seem like a full question or comment to me.
I didn't want to belabor the point if you had already discussed it. If it hasn't been discussed, there are only a handful of contract sterilizers in the country, and there's even fewer contract packagers that can really do the packaging for companies. And so those seem to be very logical places that you would have many different companies wanting to go to that same location. And one of the biggest complaints that I've seen against contract sterilizers is damage to boxes. They'll have fork trucks go spear the boxes on a regular basis, and so they actually track that as a metric. How many boxes did we destroy this month? So when you see those kinds of trends, it seems like there might be an opportunity here to dramatically reduce some shipping costs and maybe provide a little bit more protection of less than truckloads to these companies that are shipping a pallet or two of product to a sterilizer, and they need it done pretty quickly. I would think you got an opportunity here for people that need pretty quick turnaround, need to know exactly where it is, need the product protected, and you might have 10 different companies going to the same place because they all got to sterilize their product.
Agree. I don't think that was a question. I think it was more of a statement, and greatly appreciated because you're correct.
I
Just that I see
The
a
other thing is
double handling.
that
in the Northeast we have the trouble.
yeah, one of the other value propositions we didn't mention was the number of touches of a product. Let's say this cube has 40 boxes within it and it's going to a single destination. The number of touches of those boxes reduces the chances of the need for damage or more sterilization. So, and this keeps track of whether this has been opened or not. So it increases security that during the entire trip, whether these things have been exposed or not is reduced, and the awareness of how much exposure it received. So on one hand, what you're speaking about is actually the sterilization process, and on what we're also presenting is the way in which this is containerization. This is the reduction of the number of touches per box made into a container that can now be, that group can now be controlled and monitored and have greater transparency.
You'd have to be able to drop the sides on your container to keep the touches down from sterilization so that they can get in there and do the work. To me, the reason we have UDI and serialization going on in the industry, pharmaceutical and medical devices, is because we don't have this kind of tracking and tracing possible and security built in.
Yes. I think that is a major component, and I keep this slide up because it really reflects this need that's out there of something that it increases the amount of, or reduces the amount of different systems that are trying to coordinate, and at some point it drops off the map. For anyone who's experienced having their goods shipped or having even your home shipped anywhere, will be aware that in addition to just the shipment, there's always storage as well. There's a point at which things get offloaded, put into something else, then reloaded. So having all of that in one location, knowing exactly what has been touched, where something is, what its present condition is, in addition to what Dan was mentioning in terms of the ability to secure items within this, which have odd sizes. Not everything's going to be in a square box. So what's not mentioned here is also the aspect of insurance and the reduction of claims. So CubeMonk has a unique relationship with actually an insurance organization that will provide that as part of the turnkey service. I was thinking also when a question came up around there's an aspect of this that could be used for filtering on the quote, on the level of quality of the shipper or whoever might be involved. This idea of having an Expedia type selection of who you use. One great thing about technology like this is that the best providers float to the top because other users are rating them higher. So you want to have that filter to be able to get those providers that provide the best service. So again, this whole thing is an optimization system that lets the best providers rise to the top and provide a better service to the industry.
Jonathan, you had a quick question. Well, it's a quick question. I don't know if it's a quick answer.
Oh, I had a couple questions. One specifically about the device. Does it measure the internal weight? So if it is opened and something's removed, you know the difference between the internal content measures.
John, if I can answer that in a little bit of a different way. It's not going to measure the weight, but it will measure open and close. It'll also give us Bluetooth data. We have Bluetooth mesh network, so the containers are talking to each other. But it also tells us who's been around the container, like whose phone has Bluetooth on. We can swipe their information so we know who's opened and closed the container. But even more, if we work with a manufacturer that needs to know that that product is in that container, we can provide Bluetooth stickers, which is similar to old RFID technology, where the Bluetooth, when it passes the door, we know that it's in the container. We know it's there. If it's removed, we know it's been removed, and we know by who.
And I mean, it's more of a parallel with my experience, but just like the medical device industry, the luxury industry has these very high margin, high value in a very small amount of space. Have you talked to the luxury industry?
We haven't, brother. We've
Okay.
we've really kept this to moving and storage, and we're being methodical. We're working within the medical marijuana space. We're working with obviously moving and storage, and medical devices. You know, I've known Joe for a really long time, and it's always been a sweet spot for me. I've always looked at the shipping of medical devices. I used to do thermoformer work back when I was younger. Not that I'm old, but when I was getting into the transportation space, yeah, I was shipping hoods and freezers, and the amount of damage that we had for those types of items, it was massive. I mean, sometimes we get a $15,000-$20,000 claim, and it's just, I knew that this was something that was going to be needed for this particular space. So we wanted to kind of see, you know, where can we enter here? Can we get some interest from a couple folks? Can we do a pilot program and work together to figure out what the analytics need to look like? You know, what does this look like for this space? So that's what we're basically here is really, you know, opening up the door, looking for a couple of people that we can work with, we can, you know, talk with and build something that makes sense using the analytics and the technology that's available today.
Oh,
I think if
I
you're
may.
interested in the, I mean, just if you imagine maybe a pallet in the luxury industry could be worth $40 million, you know, similar to the medical device industry where the, you know, the density, value per density is shipped is pretty tremendous. You might want to have a chat later with me about that.
Of course.
And
of course.
see, you know, if like Patek or Rolex would want to work with you as well.
Yeah, we have been asked by a few companies that do shipping from China into the Miami port. Once it comes into Miami in a 40-foot container, it's got to be broken down into skids. They're using wire and shrink wrap and skids in order to redistribute it from there into smaller shipments, but they still have a lot of theft. So I completely understand, you know, definitely haven't, we've talked in that space, but I have not looked in that direction as of now, but certainly it's open. We are ready and willing to start scaling into other verticals. I chose medical devices first because of the high value nature of the devices and products that
For sure
are within it. Yeah.
Couple quick notes. One is I'm a little diminished today, to be honest with you, because you call me brother, and I felt a special kind of bond about that. And you just met Jonathan, and you called him brother, and now I realize that I'm shit.
Hey, come on. We're all one in the end, Joe.
No, but still.
Call me sister.
We're all Jonathan in the end.
Hey, Jonathan
funny.
Estes.
That's funny. Second is Sanjeev, what's with the mustache?
Prostate cancer month, so I'm just growing it out.
Oh, is this your Movember?
That's right.
Wow. Okay. I had a badass mow a couple years ago. It's been a while since I've done that. I brought you on because as a manufacturer, and I know, you know, Dan's looking for some folks to partner with, and your deep connections in the Indian market, if you had some ideas for him, just kind of top of mind things. And Josue, who's come in and out, he's based in Chicago, but he specializes in distribution through Mexico, or you can correct my inaccuracies there, Josue. I just thought that it'd be good for you guys to meet one another.
Sure. I think I was also thinking as you were talking, Dan, this would be useful also in the biotech industry, right? Because you're shipping, you know, vaccines or drugs all over, and you'd be shipping containers. So having the right kind of, you know, container to ship it in would be the right thing to do. And, you know, what you have may be the right thing there. So you may want to get in touch with companies like Roche and Pfizer, et cetera, right? Who are shipping, and Novartis, who are shipping things across the globe all the time.
And that's why we're here. I mean, thank you.
And if you want to get in touch with companies in India or China, I think I already heard you talking about China, but in India, I can get you in touch with people as well.
Yeah, we're working with some counterparts in India now, which is good. Good tech partner, and we're working on some projects in the moving and storage space there. So absolutely open to discussion. Anything, anywhere, we're open. Just like I said, this is just opening up the door, trying to understand what the space is needing. We believe we've designed something that makes a lot of sense, and we just want to make sure other people see the same thing.
What?
What
looked
weight
pretty
are you taking? Sorry, what weight are you taking in your units, or from largest to smallest about?
Would you say what weight?
Weights, yeah.
The two skid mover is 1,300 pounds, and it's a composite material panel, steel frame, and a lot of the weights in the base, because we have retractable wheels, so you don't necessarily need specialized equipment in
Right, but how much
laboratories.
weight can you put into the unit?
Oh.
That's what I'm asking.
Oh, geez, 10,000 pounds.
Okay. Yeah,
Else,
'cause
anything
those
to add?
vials are heavy.
Yeah, well, can you guys hear me?
Yes.
Yeah. Well, in Mexico, distribution is very challenging, as in most countries. It's basically run by five companies, private companies. But this year, the government created, well, it was already created, the company, but it's basically doing a distribution of pharmaceuticals and medical devices through this state-run company called Remix. So it might be a good opportunity. And there's many challenges. They've been facing many challenges, and the government has realized that shipping these type of products is more challenging than they thought. So it might be a good opportunity for you guys to maybe explore some conversations with these actors and maybe provide these types of solutions to them. And right now, the topic that's most that came out yesterday is the vaccine for COVID, that they don't have the right conditions to transport and distribute a vaccine with in so low temperatures. You know? So even if it's available, they won't be able to distribute it.
We started our call that way. You might have joined us a little late.
Oh, okay.
Eddie, you have a comment about the major shippers, UPS, DHL, and FedEx?
Yeah, some years ago, a good friend of mine actually is an analyst in the transportation sector, and he's very close with UPS. And he explained to me that they have a whole division just dedicated to dealing with medical device distribution. And so it strikes me that actually they, FedEx, DHL, may more so be your easier customers, although, you know, quite big and challenging to work with potentially.
I think you're going to have a lot of potential. Like I'm sending you home, Dan and Jonathan, with like tentacles worth of opportunity to chase. But I'm sure this is not strange for you, as you've hit on something that is a terrific multi-channel, multi-segment need, like where to focus your energy. And you've not even talked about it yet, but one of the things that lit me to, like, I have to have you on my little broadcast here is you've hardly talked about AI, and there's an AI component to all of this. Am I mistaken?
Well, it depends on who you're talking to with AI. I mean, you know, artificial intelligence, to me, it's an interesting term, because no matter what, it's human rule or human law, and one of the 4 laws anyway. And for me, it's all machine learning. So, you know, that I'll talk about all day. I know AI is a hyped up term that a lot of people like to hear. It goes well with investors, but for me, you know, it's not really real, because in the end, it's human law or human rule, if you will, that is programming that. So yeah, that's my 2 cents on what I feel about AI.
Eddie's points that I interrupted about the major carriers, your conversations with them, if at all, yet?
Yeah, we've had a couple, and you know what it comes to with guys that are that big is, you know, they're that big. You know, they're the 800-pound gorilla, and you know they'll try to squeeze you out. And you know, we've had a couple other verticals guys that we've launched things in, and they look at what we're doing, they look at the ideas, and then all of a sudden they're doing the same things that we're doing, and we're being squeezed out. So we decided we wanted to build in secret for the past 7 years. We wanted to get it to a point where we were ready to scale it and take in the funds to do so. And we'll see what happens when we get out into the field. We don't necessarily need FedEx or UPS's transportation network, nor their technology. We believe they'll end up using some of ours anyway. So we're going direct, and we've been doing it in the moving and storage and corporate relocation space. And we know that we can do it in the pharmaceutical and medical devices space as well, just because we've tackled a lot of the industry's issues and concerns where we cannot find today, and it may be out there. I'm sure someone's working on it. The thoughts come to all of us. But we haven't found anybody to tackle the issues and concerns that we have in the way that we have with regards to using machine learning.
Fair enough. Okay. My friend Luke, who was eager to see a cube, also is eager to see any kind of analytic that shows some kind of medical device angle to it so that he could recommend / pitch some kind of factoid. Now, I know, Jonathan, that your presentation is not medical device geared necessarily, but do you have anything that we can point Luke's way in terms of analytics and stats? You've mentioned a couple things, but which ones perhaps would you call out most?
Nothing short of what is common across all the industries in terms of the analytics and spreadsheets for the cost savings, particularly around load bearing, or I should say the reduction of the loads and things like that. We have been doing some work on the impact, as I'll show in this slide here, on the sustainability aspects, the cost savings on fuel reduction, on reducing the loads. But other than that, from this call, what we're looking for are actually some of the things that have been mentioned in terms of opportunities in the industry that are unique to this industry. Not everything is necessarily available from our research that shows, other than we can save time and money on the number of touch points that it takes to ship these products. We actually can streamline that. So that metric we can actually demonstrate. Anything that would be unique to the industry, we're open.
And I think that dovetails nicely into what Terry has to contribute here. So if you unmute yourself, Mr. Davis, this is the first time we're talking on camera. Introduce yourself and share what you wrote here.
I'm Terry Davis with Bridge Tech Medical. We do medical device data systems where we grab data off of the device as it rolls around the hospital or wherever it is and send the data wherever it needs to go. But my question was and we obviously work with a lot of ventilator companies, other medical device companies. If I had a company that I wanted to refer to you, who would they contact, and kind of what's your capacity to take on new business?
That's a good question. Myself or Nick or anybody in the call, Nick, myself, Jonathan, we can all help when it comes to who to contact. But the capacity to bring on new business, we are really in a governed growth. I don't like the term control, so we'll say governed growth situation where we only work with accounts to understand what their needs are, and we customize our solutions. As we're going along, because everything in the system is customizable, turning features on and off. If you're collecting analytics, sometimes you're only collecting specific portions and you're only sending, a small portion of it. Same thing here, so we work closely with our clients. The availability to add new clients is, based on the size of the client and the size of the pilot that they want to put together. We never want to just jump in and have someone say, hey, love what you guys have. I want to send you 10,000 shipments. That's not how we work. We want to understand the lanes. We want to understand and really methodically pull together a program that makes sense for everybody, where there's nothing dropped. There's no failures or service failures. It's important to us. It's quality of service, the support we give. We want to govern our growth to make sure that it's in benefit of everybody.
Right. Okay.
Thank you, Terry. Jonathan, can you take us through perhaps some of the slides that we didn't get to, if there's anything else you'd like to add with those?
I think that based on the questions that we had, I've covered what I wanted to. The image of the cube, its benefits, and what makes it different, why this industry is prime for this kind of technology, and then the actual marketplace, CubeMonk marketplace, and the streamlining of the technology to make a move low cost, easier, transparent, and all those issues have all been demonstrated. So I don't have anything additional to add to this. I did have a question back maybe Jan, you know about this, but on the pharmaceutical side, I know that it doesn't, these are two different industries altogether, but since it came up, I'm just wondering, the cold storage that was mentioned, was that, did you say it was -70 degrees that was required for this new vaccine, or was I imagining that? Was this like use of
That's what the new vaccine Pfizer has. There are other ones out there that aren't that cold, but they're not quite as far along in the testing.
Isn't usually that kind of, because what I saw out in sub-Saharan Africa was that these were small boxes that had dry ice with them. They were packed in smaller containers, not an entire large container like this, like a cube, you know, where the whole thing had to be refrigerated down to -70. That the every step of the way, though, there needed to be some control of that temperature. I'm just, I was thinking that we may not be necessarily out of that game. We may be a step that could still be a participant. And if
Right,
there is
they're
a
going to need
committee
it
that's
for
discussing-
they're going to need it for the big shipments to the distribution sites.
right.
When the government starts buying this, they want pallet loads coming in.
Yes, and that's as Dan mentioned, that's the phase that we're actually prepared to provide. And I was just thinking that if that was the case, that this could be monitored and that the internal temperature would be maintained. But the other question I had was, medical devices, as I've researched them, come in so many different shapes and sizes. From, you know, a dismantled unit could be the size of a room, to you know, small implements that, you know, that fit within a pen case. And I was just thinking that we're, you know, we want to be adaptable to those settings, but from this group, is there a particular size or configuration that what we've described actually makes sense for us to pursue faster than others? For example, the highly sensitive devices that, you know, movement, jostling, you know, any sense of the word moving them actually is harmful to them, that a system like this could help prevent that damage and provide a better logistics.
Sorry, that's why I'm a packaging engineer. I keep that from happening.
Right.
But there are drug-eluting stents that have more strict temperature controls. There are some that actually have oxygen stuff, and if your stuff is tight, you might be able to put some kind of a inert gas in there that helps keep the oxygen out. There are a lot of combination devices coming out right now that actually have a refrigerated or frozen vial to go with the device itself. So that's a combination kit. So there's things like that out there, and I can't tell you there's a particular size. I can show you a sample of the ones that I am working with, but when I was working with pacemakers, they don't have controlled temperature shipping, but if they freeze, the battery won't work. If they get too hot, the battery discharges and won't work. So there's quite a variety. A lot of what I work with are just pouches that might be 10 by 6 by ½ inch big, and then they throw a bunch in a carton that goes in a case. But there are so many other sizes. It's hard to pinpoint anything in particular. It depends upon what area you want: neurology, cardiology, what pieces you're looking at.
It's funny, you look down as though you're.
I have samples under here, but I was trying to decide if I could grab any out fast enough that would make sense, but I got to crawl under my desk to get to them. So
Okay, because you're in the garden and I was a bit confused.
yes, my backyard. I like the flowers I get.
Is that your backyard?
Yes, was on the slope of my backyard.
James Carr, by the way, earlier wanted to see how we could get a copy of Ken's kitchen background.
Presume going forward.
Yes.
I see that background every week. I like it.
Okay. Well, if the presentation is complete and the questions have dried up, let me, Dan, because this was your brainchild to begin with, what would you leave future generations of video replay people watching this to know, hear, contact you, benefit from our conversation today? What should our main takeaway be?
Just if there's anybody that wants to contact us or work with us, I don't know if I'm allowed to leave an email address, Joe. I don't want to just assume. Yeah, just you know, info
if you want.
info@cubemonk.com. The right people will get it, and just, contact us. We'd be happy to talk, happy to work together and try and work out solutions. Anything in and around shipping. We're really, really interested in, obviously, the analytics. We'd like to see the reduction in CO2 emissions, and really bring down the massive waste that this industry is seeing in space, just out of fear of sharing analytics and data with competitors. That's a big problem in our world. Greed spawns that, and I think it's something through machine learning and looking at technology and like your Uber pools of the world. It's going to change things, and can't keep being afraid of how the industry is going to move forward with machine learning. We have to embrace it, we have to understand it, and we have to work with it forward together.
Because your competitors will, so
that's
get
right.
on the ball.
It's inevitable, and those that are trying to stop it are the ones that are going to end up looking at themselves down the road later on. Companies like ourselves, they come out and they end up taking the market share because someone's built a better, sexier architecture for the space.
Speaking of which, how tight do you believe your patents and concepts, how unassailable is your technological advance today? And my friend Andrea's, actually, I'm going to promote her as well. You get to see her background with her arrows and the like. She is the patent detective. I'm interested, Andrea, if you're aware of, or perhaps in the background during this call, you started using your little fingers and looking to see what's out there. Any thoughts on what they have here?
I haven't looked into it, but I've just recently had a call with somebody who has worked in the medical device industry for a long time and was talking about the challenges of shipping and how they're thinking about starting a company. So it was just interesting how that coincided, and it just shows how big of a need this is. I mean, I know I worked on like RFID components for surgical cases and the challenges with that. So it's tough from a patenting perspective because you have a whole system here, and how to protect that. It's not the easiest thing going forward, but definitely look into it, because if you happen to make it work, you want to be able to protect your idea. But it's not the first time I'm hearing in the industry that this is a real challenge. So
we are recording on November 13, 2020. Do you presently have a medical device manufacturer among your clients?
We do not.
Would there be a benefit to you to have a marquee one or a one, to a degree that we could make something very attractive to one of my followers to work with you, and it could really be a significant benefit for them savings wise, monetary bottom line stuff?
Absolutely. We do this all the time, Joe. We'll bring our partners in that are in the initial discovery phases, and there's really no charges for what we do. We just kind of bring it, we work together, we build it, and then as we reach out and we start growing into the marketplace, the way that CubeMonk makes money is microtransactions. It's anywhere from 75 cents to $4, for the transaction and for the technology to be working in the background at all times.
75 cents per what?
75 cents per transaction or per shipment.
Transaction.
What's that?
Define transaction.
So if someone comes into the system and quotes a shipment from point A to point B, that's a transaction. If they book
Whether it actually transpires or not.
No, if it books, it's considered a transaction. So it's basically pay to play. We're not charging people to come into the system, to be part of the system. It's pay to play. So the only time there's actual fees involved is when there's an actual transaction that's occurred.
So your revenue is transaction fees?
Yes.
That's it.
That's it.
what about the cubes?
The cubes have, it depends on how you're doing it. There's a lease fee, but it's just, you have the technology. We're tied to trucking. We're tied to the cubes. We're tied to a lot of different things, and it's just based on what you're using. And as I kind of stated, if you're inside the system, you will be able to see everything. You're going to be able to have options similar to a hotels.com. If you want to add a car or a sports car, or if you want to upgrade something, you can. Or if you want someone to just handle it all for you, we have a team internally for that as well.
I'm amused
I
at
think
the
this might be
idea of
very-
your income statement saying 75 cents, 75 cents, 75 cents, 75 cents, 75 cents.
Yeah.
Like, okay.
Yeah.
This
Well,
might
it's
be
a lot of
interesting
volume.
for startups too. I mean, people in medical devices who don't necessarily do a lot, and they don't already have inherited systems that would be very hard to switch from. Basically, starting fresh slate with you guys.
I want to go back to the real quick, Joe, on the patent. We have decided and opted not to do patents, just because patent trolls and understanding that, look, you change one small thing. In today's world, you can change what you write your code in, and it's not the same, and it won't be defended in court. So we just have come to the realization that what we're building, we understand is very valuable for the world, and we understand that some people will pull it into their purview. The size container makes sense, and we're sure we'll see many mimics of what we have. But where we have a lot of faith in ourselves and our strengths is the technology and the automation behind the machine learning. It'll take years for someone to catch what we've built.
Andrea, I know we talked about this, but I didn't write it down. Did we agree on a date for your presentation?
We have not. I had a few presentations lately, and I think my last one is December 10th. And once I'm done with that, I'll focus on, because I will have to basically craft a brand new presentation for this.
I want to make sure
group,
that the CubeMonk team is aware when you're presenting. I suspect, from what you said, he's made his decision, but it'd be interesting if you have a perspective that colors his viewpoint at all.
I have to say my first job in industry, a pharmaceutical company, was reading patents and learning how to get around them.
Yep, I know. I've been down the road, so I just decided not to anymore. I used to, and I spent the money to do it, and I realized it's not worth it. It was just, you would lose more in court trying to fight someone just because they made a small loop around it. So it became not even worth to do it.
Now I'm more interested in Andrea's presentation to defend herself as having a viable business model.
Well, I mean, you might not be wrong, and maybe in your scenario, right, with the platform and the machine learning, that in itself is very hard to patent. However, like Jen says, you still should read whatever patents are out there to make sure you're not infringing. Because while you might not have the resources to take somebody to court, they might take you to court.
Aware.
Yeah.
Thank you, and great defense, by the way. And that was a great, real quick response.
Sure. Good luck.
Just about at the hour-and-a-half mark. I knew this would be not only entertaining but educational, and the reason I made today available for you was because I've seen these collaborative conversations where somebody has a concept, and the joy of this network with people with backgrounds as diverse as Jan's to mine to Andrea's, to say, have you thought of this? And I know a guy, and have you joined this association? I love when the group comes together to kind of brainstorm from lots of different angles. So I hope that.
Yeah, I want him to go to Costa Rica because they make so many things for the US and have to ship all this stuff up here. Just get down into those parks. They're amazing.
Beautiful country, been there. So absolutely.
Did you guys hear my wife sneeze just now?
We did.
That is so loud. She's got the loudest possible sneeze. The door is closed and she's 2 rooms away. I think that's as fitting a way as any to end today's call. Thank you, everybody. Jonathan.
Thank you.
You're in the dark.
Thank you, everyone.
And Dan and Nicholas and Ken, the CubeMonk team. Thank you very much. And
make it a good one.
Let's talk soon, Dan. Okay.
All right. Make it a great one, guys.
Thank you, everyone.
Take care.
Bye for now.